Hey, this video will be an introduction to bulimia, or more formally known as bulimia nervosa in the mental health community, in the medical community. This disorder is a mental health disorder that is characterized by binging, which means consuming an inordinate or a large or a great amount of food or nutrients, and then purging, or getting rid of that food and nutrients before your body has a chance to really absorb it or to deal with it or to use it. So what are the different ways of purging? Well, the big ones are going to be vomiting, and the other one's going to be diarrhea, right? So somehow in that GI tract, this person's going to try and get rid of all that food they just binged on, either through making themselves vomit or making themselves, pass that, defecate, and that's going to be commonly through laxatives, that sort of thing. These are recurrent episodes. These are things that go on for a while. The common board setup you're going to see for this are going to be the people that have eroded teeth. I'm going to write teeth, because if you are constantly vomiting, well, that acid is just going to burn its way through your teeth, so you're going to see poor enamel, that sort of thing. Parotid glands, which are salivary glands on the sides of your face, those are going to be huge because you're constantly making more saliva to help with that vomitus. And the other thing, this is, in theory, I could see it happening, but you don't actually see this that much in practice. You're going to see scrapings or abrasions on the back of the hands. And the thought process there is that these people are sticking their finger in their throat to make them vomit. And, I don't think this doesn't happen typically in the clinic. These people don't present with this scraping in the back of their hands, although in theory it could happen, and I'm sure it has happened, so I don't want to discredit it. But this binging and purging, and one interesting thing about bulimics, or people who have bulimia nervosa, is they know that what they're doing is unhealthy. They're not like another disorder, for example, is anorexia, which we have some videos about, but bulimics, they know that what they're doing is wrong, and they're more likely to seek out help. Another interesting thing is that these bulimics are commonly of normal or are overweight. So these aren't going to be very skinny people that you see going down the street, right? These people are going to be normal or overweight people who are trying to slim down or think it's unhealthy if they binge. So it might even be, someone who just really likes chocolate cake, eats 3 chocolate cakes and then throws it up. That's not healthy, and we could even probably make a case for that person having a bulimia nervosa disorder, even if they're not necessarily doing it every day. But these people are going to know something's wrong. They're going to know they shouldn't be doing this. They're going to show up with these different symptoms if it's recurrent. So the poor dentition and the lack of enamel, the parotid gland enlargement or hypertrophy because of all that extra saliva being made, and the abrasions in the back of the hands from constantly throwing up and prepping that throat for the vomitus with more saliva. The treatment for these people is going to be not so much psychotherapy, but more working with them through their issues and possibly medicating them, maybe with an antidepressant, that sort of thing, to make them gain self-image, to make them not lack confidence, and to make them understand that their body image, it's healthy, and there are healthy ways to go about it without necessarily making yourself throw up. The most common people that we're going to see this in are adolescent girls, those girls that are in a transition time and might, lack confidence or lack self-image, security, that sort of thing. And it commonly coexists with depression. So that's what we talked about. These people are depressed, and possibly putting them on an antidepressant and trying to help their mood and stabilize their mood that way. With an antidepressant, get rid of their depression, it might help this disorder get away. But, the gist of bulimia nervosa is it's binge eating, losing control of these eating episodes, overeating, that sort of thing, with recurrent inappropriate compensation, like the vomiting or the diarrhea, the purging to get rid of that, the nutrients, the food they just got. The true definition in the DSM, or the diagnostic manual that a lot of people use, is that it has to be going on for at least 3 months, and there has to be this distortion, this poor perception of body image. But like I said earlier, I think you could probably make a case for someone who regularly binges and purges, even if it hasn't been going on, regularly for 3 months, but happens once every so often, that sort of thing. It's never healthy to binge and then purge through one of these manners. That's an introduction to bulimia nervosa. Thanks for watching.